Venous blood is blood collected from a vein, usually the median cubital vein in the antecubital fossa of the arm. It is the most commonly used specimen for clinical laboratory investigations, such as hematology, chemistry, serology, and microbiology. Collecting venous blood is a key procedure in medical diagnostics, and it's important to follow the right steps for collection. This involves a technique known as a venipuncture. Venipuncture is the process of obtaining venous blood by puncturing a vein using a sterile needle. It is the most common invasive procedure performed in medical laboratories, hospitals, and clinics for diagnostic, therapeutic, and monitoring purposes. Here's a quick overview of the process of venous blood collection. Patient preparation. Explain the procedure to the patient. Ensure fasting state where required, for example, lipid profile, fasting glucose. First, gather all necessary requirements. This includes gloves, alcohol swabs, a tourniquet, sterile needles, and blood collection vacutainers. Having everything ready helps ensure a smooth procedure. Verify identity of patient, explain procedure, and obtain consent. Position the patient arm extended, supported, palm facing upward. Next, apply the tourniquet to the patient's upper arm to make the veins more visible. Ask the patient to make a fist. Select vein, commonly median cubital, cephalic or basilic vein. Clean the puncture site thoroughly with 70% alcohol swab to reduce the risk of infection. Allow to air dry. Aseptic conditions must be maintained to prevent contamination or infection. Collect blood using vacutainer system or syringe. Insert needle into the chosen vein with the bevel facing up at an angle of about 30 to 45 degrees. Loosen the tourniquet. Once the sample is collected, remove the needle and apply cotton and pressure to the site to stop bleeding. Finally, label the vacutainer and dispose of used materials safely. Proper technique ensures reliable results and patient safety every time. Now let's look at the blood vacutainers or collection tubes. Blood collection tubes, also known as vacutainers, are specialized containers used to collect, transport, and preserve blood specimens for laboratory investigations. They are color-coded according to the type of additive or anticoagulant present, which determines the nature of the specimen obtained, serum, plasma, or whole blood. Correct tube selection is essential to ensure accuracy and reliability of test results. Plain tubes, usually with a red cap, contain no additives or may have a clot activator. These allow blood to clot, producing serum after centrifugation. They are widely used in chemistry and serological testing. Serum separator tubes, gold or yellow tops, contain clot activators and a gel barrier that separates serum from cells, minimizing contamination and facilitating stable storage. Anticoagulant tubes prevent clotting by different mechanisms, and this include lavender or purple top tubes contain ethylenidiaminotetraacetic acid, EDTA, which chelates calcium and preserves cell morphology, making them ideal for hematology tests such as full blood count. Ideal also for parasitological tests such as thin film and thick smears. Light blue top tubes contain sodium citrate, which reversibly binds calcium, maintaining coagulation factors for clotting studies, such as prothrombin time and APTT. Green top tubes contain heparin, an anticoagulant that inhibits thrombin and factor XR, providing plasma for cardiac profile tests, chemistry and blood gas analysis. Grey top tubes combine potassium oxalate and sodium fluoride, the latter inhibiting glycolysis, making them the standard for blood glucose and lactate testing. In addition, specialized tubes exist for unique purposes. For example, black top tubes containing sodium citrate are used for erythrocyte sedimentation rate, ESR, while yellow tubes with acid citrate dextrose, ACD, are used for DNA testing, HLA typing. Trace element studies require royal blue top tubes, which are free from contamination. Blood culture bottles are also blood collection containers mainly used to collect blood for growth of microorganisms, for example, bacteria. Aerobic bottles, which contain media that support organisms requiring oxygen. anaerobic bottles, which favor the growth of organisms that thrive in oxygen-free environments. Blood culture bottles may also contain anticoagulants such as sodium polyanethyl sulfonate, SPS, which prevents clotting and inhibits complement, phagocytosis, and some antibiotics, thereby enhancing pathogen recovery. Correct aseptic technique is crucial during collection to avoid contamination with skin flora, which could lead to false positive results. Order of draw of blood. When multiple tubes are collected in one venipuncture, a standardized order of draw is followed to prevent cross-contamination of additives between tubes, which may alter test results. The commonly accepted order is blood culture bottles, light blue top tubes, serum tubes, green top tubes, lavender or purple top tubes, grey top tubes. Proper order of draw ensures specimen integrity, accurate results, and ultimately better patient care. In conclusion, blood collection tubes play a pivotal role in laboratory medicine. Each tube is designed with a specific additive and function, and proper choice according to the test requested is crucial. Misuse or mislabeling can lead to inaccurate results, misdiagnosis, and compromised patient care.